Creating more awareness in the fight against cervical cancer will reduce the mortality rate that emanates from this preventable disease. At this gathering, Medical Impact called for the engagement of girls and women to eradicate the disease in the country.
It is a sexually transmitted infection because it's transmitted during the exchange of body fluids and all that. So there is need to protect not only the girl child, and then later in life, be able to transmit it. However, I was saying that because the need is much greater for the girl child who can be protected, so they never get the HPV.
We are leveraging on the community pharmacy to be able to stop and prevent cervical cancer in our locality.
No woman should be dying from cervical cancer today. No woman, wherever they may be, should be dying of cervical cancer. But before the end of today, about 22 Nigerian women all over the country will die from something we can prevent.
Cervical cancer is one cancer that is 98% preventable, and it is a major killer of women. It is the second most common cancer, not only in Nigeria, but all over the world. So a program like this that is aimed at addressing the health inequities that exist in our societies, that addresses the awareness gap that exists in our societies, that addresses the vaccine hesitancy that is the attitude of most Nigerians, will surely go a long way in addressing the challenges, in addressing the gaps.
Speakers say continuous sensitization and early detection will help reduce the virus.
The first part is screening, getting tested. The second part for young girls is vaccination. We have an effective vaccine, has very few side effects, it's safe, it's reliable. This vaccine is really important for young girls aged 9 to 15.
When you look at the literacy rate, over 50% of the population are not educated. And when you look at the out-of-pocket expenditure for healthcare, over 80% of the individual population are paying for healthcare out of their pockets. The national health insurance cover is still not very much enough, to cover all Nigeria. So definitely, and this is healthcare generally.
They go to their community and start talking to their fellow women about this. They are likely to accept it. And exactly what we are doing today, 7 of them will go to their communities and implement. And in the implementation, each of them are going to identify 50 young girls that are willing to be vaccinated.
Meanwhile, Medical Impact are seeking support of relevant key players to embrace effective primary and secondary prevention approaches for treating precancerous lesions to prevent most cervical cancer cases. Maugbe Josu, LTV News.